Welcome back to America Decides. Manhattan District Attorney Alvin Bragg says the man accused of killing United Healthcare Insurance CEO Brian Thompson could drop his fight against extradition to New York. A hearing about that is scheduled to be convened tomorrow in Pennsylvania. Luigi Mangione remains in custody at a Pennsylvania state prison. Sources say a New York grand jury is reviewing evidence in that case. Dr. Dhruv Khullar joins us now. He is an associate professor of health and economics at the Weill Cornell Medical College. He is also the author of a new article in the New Yorker magazine entitled "The Gilded Age of Medicine is Here." I want to read from that, Dr. Khullar. It's great to have you with us. This is a graphic we have prepared. Quote, "Today, healthcare is where the money is. New technologies and treatments sustain the impression that patients have never been healthier, but corporations and conglomerates wield immense power at the expense of the people they're meant to serve." Is that what the Gilded Age of medicine means?
That's what it feels like. I mean, there's so many ways today that the healthcare system feels like it's more focused on extracting profits than actually on caring for people. I mean, you think about how many ways in which the healthcare system is being gamed by private insurers or private equity firms, even nonprofit organizations. They're increasingly acting in ways that don't serve the best interests of patients. And people are understandably concerned, they're disappointed, and they're even angry.
You mentioned private equity firms. CBS News has covered the impact of private equity firms taking over hospitals. In some cases, they've been shut down. In some cases, care has been compromised. You describe that in great detail in your article. Summarize that for us.
That's right. I mean, private equity activity has grown by leaps and bounds over the past decade. They've been acquiring hospitals, they've been acquiring nursing homes, they've been acquiring physician practices. In some markets in the United States, more than half of physicians in a particular specialty, their practices are owned by a private equity firm. You know, often private equity firms might argue that they infuse capital into things like hospitals that are on shaky financial ground, but research increasingly suggests that they put a lot of hospitals into shaky financial position by their acquisitions. And so I talk about one organization called Cerberus Capital, which bought 6 hospitals in Massachusetts, and over time sold the land that the hospitals were standing on. And so the hospitals had to pay rent on land that they'd previously owned. That created all sorts of financial problems for those hospitals. And ultimately, that hospital system known as Steward Healthcare went bankrupt this past year. And a lot of patients and healthcare workers have been harmed in the process.
I want to read another graphic that we have put up from your article. Quote, "Increasingly, health insurers, private hospitals, and even nonprofits are behaving as though they aim first to extract revenue and only second to care for people. Patients often are viewed less as humans in need of care than consumers who generate profit." When did this start, and what is accelerating or exacerbating that trend?
You know, it seems like it's been getting worse over time. Part of what's happened is that there's been a lot of actors that have entered the healthcare space, in part because it's such a large part of our economy. So if you think about healthcare, it's more than 15% of the economy. I mean, $4.5 trillion in healthcare. And so more and more organizations, whether or not they have a medical background, are getting involved in the healthcare space. And that has accelerated over the past 1 or 2 decades. And so we see a lot more private sector activity in this space. Some of that is good. It can lead to some types of innovation, but a lot of that can be troubling when it turns into kind of a gamification where the goal really is to extract profit and not to care for people. And, you know, I'm a doctor. I care about medicine. I care about the healthcare system. And that's why it's so tough to see it being used in this way.
Who is responsible, or what is responsible, for the perverse incentives that lead to overbilling?
Well, this is the thing, that there's a lot of blame to go around. I mean, you think about the government sets up certain types of incentives that are then easily gamed by the private health insurance system. So in my piece, I talk about Medicare Advantage. And so people might not know, but half of all seniors in the United States are no longer in traditional Medicare. They're in these private health insurance plans run by places like United Healthcare or Aetna or Humana. And these Medicare Advantage plans, they have incentives to care for people, but they also have incentives to make those people look as sick as they possibly can, because they get more money from the government if they care for sicker patients. And so part of the game that has occurred is not just caring for sick people, but finding diagnoses. And so they might send nurses to patients' homes to record diagnoses. They comb through the medical record to find additional diagnoses. Some investigations have found that they even have practices competing against one another to see who can find the most diagnoses in patients. And so those are the types of things that don't necessarily feel like they're improving medical care, but really just a way to try to get more money for doing kind of the same thing.
Very quickly, Doctor, do you have any sense the incoming Trump administration wants to take any or all of this on?
Well, that remains to be seen. I mean, they have a very eclectic group of individuals who are coming into the healthcare part of that administration, and so we'll have to see, what type of stance they're going to take against corporatization of medicine, consolidation in medicine, and my hope is that there is some action taken against some of the worst excesses, but we'll find out in the months and years ahead.
Dr. Dhruv Khullar, thank you very much for your time.